Hi, I'm Dr. Bea. Today I want to talk to you about BPPV, or benign paroxysmal positional vertigo. It's one of the most common causes of dizziness or vertigo, and it feels like a sudden sensation where your head is spinning and you may fall to the floor. Symptoms include mild to intense dizziness triggered by changes in the position of your head, such as when you tip your head up and down, or when lying and turning over in bed or sitting up from bed. Typically, there can be a loss of balance or unsteadiness, nausea and vomiting, abnormal rhythmic eye movements known as nystagmus. This is not a serious condition, although it is very bothersome and it can increase your chances of falling. The most common cause of BPPV is the middle ear. There are crystals in the middle ear that can become dislodged, and when they do become dislodged, they make it difficult to balance the intracranial air from the extracranial pressure. This semicircular canal becomes sensitive to head positional movements, and it makes you feel dizzy. Patients greater than 50 and women are at higher risk for BPPV, although it can occur at any time. In our office, a healthcare provider will do a test to check for an abnormal rhythmic eye movement known as nystagmus. If this occurs in one eye, the abnormal or pathological ear is the opposite ear. We will then make a decision regarding BPPV and help you with the treatment. BPPV can go away on its own, but it can take weeks to months. In 60% of patients, the first treatment of the Epley's exercises resolve the symptoms. These exercises are performed in our office, and we teach you how to do the exercise at home. The goal is to make the crystals move back into the normal position and allow your middle ear to balance atmospheric pressure. I have seen patients get successful relief from their symptoms by using a rocking chair, as the rocking movement of the head is very similar to the Epley's maneuver. Many healthcare providers also prescribe meclizine or Antivert. However, I've seen many patients where Antivert does not work, and Antivert has a substantial amount of side effects, which include dry mouth, constipation, urinary retention, blurred vision, low blood pressure, drowsiness, dizziness, headaches, and vomiting. The best treatment is by performing the Epley's or labyrinthine exercises at least 3 times a day at home for at least 1 to 2 weeks after the symptoms disappear. BPPV can recur even after successful treatment, and there is no known permanent cure. However, as mentioned, symptoms can be controlled effectively with labyrinthine exercises. Joanna will now demonstrate the Epley's maneuver.
Hi, my name is Joanna Bringas, nurse practitioner with Dr. Manuel Abella, and I will be showing you the Epley's maneuvers for BPPV. Okay, so for the first step that we will start with is called with the Epley's. The first step that we do with the Epley's maneuvers is turn the head for 1 minute on the affected ear. And on this patient, her affected ear is the right side. So first we would start here with her head dangling, with her head hanging from the edge of a bed. She would turn her head to the right for a minute. Okay, and after 1 minute, we turn it to the opposite side. And this we would do for another minute. After this, we would put her completely to her side with her head still hanging. And this we would do for another minute. After this, she would put her chin towards that side of her chest and then completely sit up. Completely. And she would do that for another minute. We would recommend for these patients to do it at least 3 times a day for a week, and these should help resolve the symptoms of BPPV. Thank you.